We had a freshman this year who developed a blister on the bottom of his foot and didn't seem to ever get any better, continued to get worse and worse. Then he ended up going to the doctor. We found out it was staph infection. Ended up being a pretty big deal. We had to have kids take equipment home, sanitize it, brought custodians in, shut the locker room down for a couple days. I've never really seen this in my previous experiences happen until just this last couple of years, and it seems like it's just like came out of the blue, and all of a sudden we've got this problem with staph infection, and I didn't think it'd be something that I was dealing with as a football coach.
I've been coaching cheerleading for the past 8 years now, and just this season we had to withdraw from a couple competitions after one of our girls got a staph infection just from shaving her legs.
I've been coaching wrestling for 35 years, and in the last few years we've seen more and more incidents of skin infections, specifically the staph infection, which for us is scary because that can really shut our program down. We're doing all we can to keep our facilities clean, our wrestlers in and out of the showers as often as possible. We also know that in the Midwest there's been a program that's a Division I program that's had trouble with it, and we're really concerned, and we want to get this taken care of.
USA Today has called it the new superbug. Time magazine has called it the killer bug facing America. Schools have been shut down because of it. And it's estimated that 60% of all infections seen in emergency rooms across the country are caused by this new superbug. What is it? Methicillin-resistant Staphylococcus aureus. Now that's a lot of big words to describe a big problem. More than likely, you'll hear it referred to as MRSA or MRSA. Some people will simply refer to it as a staph infection. No matter what it's called, MRSA is spreading across the country at an alarming rate. In a nutshell, MRSA is bacteria that can live on skin and many other surfaces, like towels, floors, and even sports equipment. MRSA bacteria cause the type of staph infections we will discuss in this video. These staph infections are commonly referred to as MRSA infections. The emerging health problem is affecting people all over the country.
Last year, we had what we consider an epidemic of staph infection, an outbreak, primarily focused on our wrestling team. But of our 1,200 kids, we had 19 that were diagnosed with some form of staph throughout the season, and of that, we had 4 that we believe were MRSA infections.
Been involved in coaching and athletic administration for about 22 years, and I'm at a school of around 1,300 kids, of which approximately a third of them are involved in our athletic program. And I'm concerned about educating our parents, coaches, and kids about MRSA and how to prevent it and how to treat it. With our decreased budgets in the last few years, we're short on custodial time. Our towel services have been non-existent. So it means that the battle's a tough one, and anything I can do to fight that and win, I'm all for.
Right now, we'll introduce you to MRSA and give you some solid information on this new challenge for parents and coaches. You will learn what MRSA is, where it came from, and what you can do about it. This is a very big problem, but there are things you can do right now to minimize the risk of a serious outbreak. First, let's hear from Dr. Mark Christensen, Professor of Pharmacy at Oregon State University.
Staph aureus is a bacterial or a microbe that most people have on their skin at all times. And over the years it can have caused infections, and so they developed drugs to treat that. One of that class of drugs is penicillin. In that class of penicillin is a drug called methicillin. Methicillin was designed to be non-resistant to the bacteria, but the bacteria have actually developed resistance to this bacterial penicillin, methicillin, and to many other types of antibacterials over the years, so that they're resistant to just about all classes.
In 2000, there were only about 100,000 reported cases of MRSA. 5 years later, that number had jumped to an estimated 5 million. MRSA has reached epidemic proportions in the United States. Let's find out how MRSA got to be such a serious problem so quickly. Here's Dr. David Bearden, a clinical associate professor and a clinician specializing in infectious diseases.
I think the introduction of the organism itself, the bacteria that causes the infection, once it got into the community, it was set up to spread very quickly. And the specific strain that's out there now is something that really didn't exist in the current form, likely, up until the last 5 or 6 years. I mean, I think definitely the changes with community-acquired MRSA has become a new epidemic. And I think that MRSA as itself has been an epidemic for the last 20, 30 years, but certainly there's almost a new epidemic with community-acquired MRSA. The community-acquired MRSA risks were first seen in pediatric populations, so in children. And then we've also then started to see it in other populations. It was seen in prisoners as an early sentinel site. And then more and more we've seen it in athletics. So there's certainly been well-documented cases of seeing it in sports teams on every level, including professional football. And I think that's really where we've started to really realize that this is a big issue. And I think the key here is that the pathogen itself, so this community-acquired MRSA, is an organism that lives very well on healthy skin and that can infect healthy patients and doesn't need to have a debilitated host. So instead of seeing the elderly individuals or the people in the hospital with a lot of other disease states, this organism itself is set up to survive very well on an otherwise healthy person and has some factors involved in its genes that allow it to thrive actually in very healthy skin. So your younger people are just as at risk and in some cases seem to be at more risk than your typically older infected patient in a hospital.
Previously, I mentioned that some schools had been shut down because of MRSA. Here's how one school responded when faced with an outbreak.
How we addressed that was through education. We asked that teachers distribute information basically on identification of wounds, that it's any wound, because if people carry staph, that you need to take care of that we need to clean it properly, use appropriate antiseptic, and then keep it covered. And then we talked about maintaining a clean environment, not just in the athletic area, but in the classroom area, keeping it disinfected, keeping things available for kids, such as antiseptics, to clean up if they felt that they needed to do that. It was a kind of a scary time, but with that education, we feel like that we've gotten a handle on it, and mostly that we can address this. It's not going to go away, we know that, but teachers, people aren't so scared now, and they know this is what we need to do.
Athletic trainers are on the front line in the fight against MRSA. Here's what they have to say.
I'm in the wound management business, and over the last couple of years, I've seen an increase in infectious skin disease, specifically staph. You know, if we teach our kids general hygiene along with wound treatment, those two things are key to helping them be healthy and then keeping our kids in the game. You know, there are a few things in the staph prevention program that I like to tell all my athletes. First, I tell them, treat and cover your wounds. And don't share personal items. And make sure you shower after physical activity. And properly clean all your gear and your equipment. It's good to keep your hands clean. And then consult your trainer or physician for all active wounds. You see, it's just as simple as that.